Most people don't struggle with back pain because of one big mistake. They struggle because of a series of small, repeated decisions that seem logical at the time, but work against recovery. Once you understand these patterns, things usually start to improve much faster. The fourth mistake is waiting too long to get clarity. A lot of people hope the pain will just settle on its own. Sometimes it does, but when it doesn't, weeks turn into months, and the problem becomes more complex. Pain that isn't improving over time needs to be understood properly. Not guessed, not ignored, not managed randomly. Clarity early on makes a significant difference. The second mistake is resting for too long. It feels like the safe option. If something hurts, you avoid it. But as we've already covered, prolonged rest leads to weaker muscles, stiffer joints, and increased sensitivity. The body becomes less capable of handling normal movement. Recovery requires movement, not complete avoidance. The third mistake is chasing passive treatment only. Hands-on treatment can be very effective. But if that's all that's happening, progress often plateaus. Long-term improvement usually requires some form of active involvement. Movement, strength, gradual loading. Without that, the body doesn't adapt. The fourth mistake is over-relying on scans. People often assume that if they can just find the exact structural problem, everything will make sense. But scans don't always explain pain. Many findings are common in people with no symptoms at all. Focusing too heavily on scan results can create unnecessary worry and distract from what actually improves outcomes. The fifth mistake is pushing too hard too soon. Some people take the opposite approach to rest. They try to push through pain aggressively, thinking it will speed things up. This often leads to flare-ups. Recovery is not about extremes. It's about finding the right level of load and building from there. The sixth mistake is expecting a perfectly linear recovery. People expect pain to steadily improve without interruption. When a flare-up happens, they assume something has gone wrong. In reality, recovery often includes temporary setbacks. Understanding that prevents unnecessary frustration and poor decisions. The seventh mistake is lack of consistency. Doing the right things occasionally is not enough. Recovery is driven by consistent input over time. Small repeated actions build capacity. Irregular effort usually leads to slow or unpredictable progress. The final mistake is not understanding the problem. Patients often go through treatment without a clear idea of what's actually happening. They don't fully understand why it hurts, what stage they're in, or what improvement should look like. Without that understanding, it's difficult to make good decisions. Good care should always include clear explanation. Back pain is rarely solved by one single intervention. It's managed through a combination of understanding, appropriate treatment, and gradual return to normal activity. Most people don't need more complexity, they need better direction. If you avoid these common mistakes, recovery becomes much more straightforward. Not necessarily instant, but far more predictable. The goal is not just to reduce pain in the short term. It's to build a body that can handle normal life without repeatedly breaking down. And that comes from making better decisions consistently over time.